It's Etch back with another health highlight from Michigan Primary Care Partners and Y102. Now let's talk this week about something that as we get older seems to compound and get more problematic. I'm talking about back pain. Now, back pain can happen as early as our teens, and we don't even know it because it could be a sports injury, it could be something along the lines of, a slip and a fall, something like that. But when we're younger, we have a little bit more cushion. We don't feel it as much, right? But then as we get older, those problems start to rear back up in their ugly heads, and we don't even know it until it's just like, oh, this is the worst pain of my life. I got shooting pain down my leg. I got all these problems, and it just all seems to be coming from my back. So there's a difference when it comes to musculoskeletal pain and actual pain that is derived right directly from your spine. Because there's a lot going on in that small little column, right? There's a lot of nerves in there, a lot of issues that could be coming about. Now, we're going to talk this week about disc herniation. So a herniated disc, we've heard about this, right? Now, what is a herniated disc and what can cause it? That's our big question. Also, how do specialists diagnose the problem, and where might I feel pain if I potentially have a herniated disc? And that's what Michigan Primary Care Partners wants to address this week in Health Highlights.
Back pain is very tricky. Okay, there's a lot that goes on in a very small space in your back where your spine goes from being a column, which is lumbar spine, to a base, which is called the sacrum. So there's a lot that can go, unfortunately, wrong as we get the opposite of younger. There's a lot of arthritis that takes place, which is normal. I expect arthritis in the low back. Herniated disc is something slightly different, is when the little shock absorbers that live in between the bones in our back move out of place. When they become really problematic is when they try to impinge on nerves that come out of your low back. Nerves like their own real estate, and then if something impinges on them, they don't like that, and they only let you know about that in the only way they know how, which is sending pain down its own course. And typically we feel that in the leg. Different nerves go down the leg, and they have their own path that they travel. And so that's what we try to figure out when the patient comes in. That pain in the leg, is it coming from a particular nerve coming from the low back, or is it something like different that's maybe like a joint problem that's coming from the back? So if somebody comes in with a lot of back pain and the pain is really shooting down their leg into their foot or towards the knee, quite often that can be a herniated disc that's coming from their back. We do have a lot of options that we offer to our patients that can help lessen their pain. And by lessening the pain, we're improving every other aspect of their life as well.